one. My son is getting nosebleeds. What is the best way to deal with a nosebleed when it is happening, and when should we be worried? And I love this question because my son's only had one nosebleed, but whenever somebody gets a nosebleed, there's always the big discussion about, do you put your head back? Do you tilt your head forward? What do you do?
The first aid generally recommends sit up and lean forward because you don't want to be swallowing too much blood into the stomach, which can be irritating to the stomach and make you nauseated. So you want to sit up, lean forward, and then pinch your nose closed, maybe with some gauze or a handkerchief or something, and just pinch it closed for about 5 to 10 minutes. And that usually, for most nosebleeds, will be enough to stop it. The time to be seen by the doctor or in urgent care is if you've been doing that and it hasn't stopped in 20 minutes, then the child needs to see the doctor.
Okay.
And the big issue then is how to prevent nosebleeds and what might be causing them. It's rare in kids, but you want to rule out a serious medical problem like either a bleeding disorder like von Willebrand's, which is a genetic familial bleeding problem, or high blood pressure can actually contribute to nosebleeds. But by far in kids, the cause of nosebleeds is just the mucous membranes in the nose get dried out and there's millions of tiny little fragile capillaries and they'll bleed easily. So to try and prevent that when there's not a nosebleed, if the child will allow the parent or if they'll do it themselves, drop or spray one little drop of saltwater nose drops and sniff them up, one in each nostril, and sniff. The salt water toughens the blood vessels, and then follow that. They can dip their pinky finger in a little small jar of clean Vaseline and just put a dot there and a dot there. You don't want to put it way up or anything because that could do more damage. And try to teach the child not to pick their nose. And after you've just immediately stopped a nosebleed, you don't want to do a lot of blowing of the nose or bending over because that could bring about a rebleed.
Okay, and so you talked about if it goes longer than 20 minutes for a single nosebleed, that's when you should seek medical help. But what about frequency? And obviously, if a child got one nosebleed, that we could do the salt water and we could do the little bit of Vaseline on the end. I didn't know about that, so thank you for that information. But if a child gets a nosebleed and then like a week later they get a nosebleed, how often would it have to be before you went, okay, this is a concern?
Well, if they're getting frequent nosebleeds, one every week or something, that you do want to go see your doctor. But that's, as I said, it's usually a local phenomenon just related to the mucous membranes in the nose. Okay. And the saltwater nose drops you should actually do twice a day, every day, like for the next 2 or 3 years, if you want to decrease the frequency.
Okay, great.
And if you do that regularly, then they may not need to see an ears, nose, and throat doctor or have the blood vessel cauterized. Sometimes for really severe recurring nosebleeds, the ears, nose, and throat doctor needs to cauterize the vessel. But that does not always solve it, and you can still get frequent nosebleeds after the cautery. So if you can prevent the need for cautery by doing the saltwater nose drops and the Vaseline twice a day religiously, that's a much better outcome.
Okay, sounds good to me, and I did not know that information, so that's really good. Now, it's interesting that we got a lot of ear, nose, and throat questions today, and I don't think they're related, actually.
Yeah, just the season, I guess.
It is. Truly, it is. What are we saying? So we have another question for the unicorn. They said fumes, such as perfumes and incense, trigger asthma. Do you recommend wearing a mask when we need to be in those environments? Could be the teacher. Or out in community, any type of brand of mask we should look for, and thank you. I think that what they're saying is that and we've experienced this before, not from an allergy standpoint, but a teacher that liked to wear a lot of perfume, and our child just sensory wise didn't like it. But I can't even imagine if the teacher was wearing perfume and it triggered your child's asthma. Would a mask help that, Dr. Copeland?
It might, but and we'll talk about the mask because I think that's a great question, and there are some things you could do. But specifically for a teacher, I think it's the responsibility of the teacher to realize that perfume can be a very serious trigger for some students. And that's teaching in class is not the time to wear perfume. So that's worth talking to the teacher about it. And hopefully the teacher would resolve it right there and then.
Yeah.
But if need be, having a conversation with the school in general to increase the awareness that there can be some very significant medical reactions to exposure to perfumes. But of course, you can't do that for all of the public. So going out in the community, the idea of wearing a mask is a good one. And there's a helpful website called Achoo Allergy. So that's all one word, ACHOO allergy, all one word, .com. And they review the evidence on helpful masks. You want a mask that will screen out particles as well as fumes. And so they're categorized and labeled either N95 or N99. Those are good ones for screening out particles, but to also screen out fumes, they should be combined within that mask with what's called an active carbon filter. And so that website reviews a lot of the different options, especially if you're going out in the community where you can't ask everyone to not wear perfume or, there's going to be exposure to fumes.
The unicorn. And our next question, somebody said, for the unicorn, are there differences between fish oil and cod liver oil, and is taking fish oil enough? And thank you.
Again, another wonderful question, and it depends on what you're trying to treat nutritionally for your child as to whether it's enough or not. But cod liver oil comes from the liver, specifically of the cod fish, whereas fish oil comes from the body of any of a variety of fish. And they have somewhat different ingredients. They both can be very nourishing. Cod liver oil is an excellent source of vitamin A and vitamin D, as well as helpful fatty acids, the omega-3 acids. But in terms of the types of omega-3 fatty acids that cod liver oil has, it has more DHA as opposed to EPA. Those are the two big omega-3 fatty acids, DHA and EPA. Whereas the fish oil has more EPA than DHA and is not particularly a source of vitamin A or vitamin D because it comes from the body of the fish and not from the internal organs. So it all depends on what kind of nourishment that you think your child needs more of. They both can be healthy choices. And I have to confess, my sister is taking cod liver oil now, and she told me about a brand that doesn't taste too bad. She can tolerate it. And I'm sorry, I don't remember the brand. I meant to check it this morning and didn't get a chance to. But that can be the difficulty with a lot of the cod liver oil. It has a strong, strong taste. Yeah. So getting the children to take it can be tricky, and it may be easier to get them to take fish oil. I think you and I have talked, Shannon, before that I really like Nordic Naturals.
Me
so
too.
That would be a good source of getting either fish oil or cod liver oil. And in general, I recommend going also with American products when it comes to the fish oils. You want to get wild-caught fish, but you want to know that they've been processed in the United States and they've been distilled to remove any mercury. And my only other caution with that is since cod liver oil is very rich in vitamin A, you want to make sure you're not giving other additional sources of vitamin A that is animal source of vitamin A as opposed to beta carotene, which is a vegetable kind of pre-vitamin A, because too much vitamin A can be quite toxic to the liver and the brain. So you don't want to go chronically above the daily recommended daily allowance.
It's a very interesting thing that, for a lot of people who will write in and tell us that when they put their kids on cod liver oil and get the vitamin A, that I've had many parents tell me that their child's ability to make eye contact improves greatly. I will tell people, just so that you know, on the flip side of it, other kids, we put my son on it and we lost some eye contact, and we tried for 30 days. So I don't know what it was about it that he couldn't tolerate it. So a very interesting thing, and it's one of the reasons why I always recommend that parents we wouldn't have known that. We wouldn't have known that it was it was cod liver oil and had the vitamin A in it. We wouldn't have known that was what it was, except that we kept very strict records and we only introduced something new, one thing at a time, and we would wait 30 days because sometimes, you've talked about this before on the show, that sometimes you have to try something, and if they're not having too severe a reaction, you have to wait to see. Like I know with die-off, sometimes you got to give it a college try before you say enough is enough.
Yeah, I think that's wise, Shannon. I like your approach. One thing at a time, give it 30 days, give it at an appropriate dose, and then see what happens while, trying to optimally support your child's health and nutrition.
Yeah. But for some kids, it can be something that's really, really amazing. Now, I want to move on to another ear, nose, and throat question. Somebody said, thank you, Dr. Copeland. What is a safe way to treat a sore throat? I can't get my son to gargle, and we don't allow him to have artificial colors or flavors or sugar.
Okay, so it depends on what else is going along with the sore throat. The majority of sore throats are with sniffles, runny nose, maybe little swollen neck glands, maybe a little cough, but usually not high fever or severe difficulty swallowing or whatnot. So it's your common kind of head cold, sore throat, upper respiratory viral infection. And because those are viruses, and usually you get some degree of laryngitis, if you get some mild voice change with it, it's more likely to be from a virus than from bacteria. But you do have to watch the child, because if they've been fighting a head cold and then they spike a high fever or get severe ear pain or sinus pain, they could have a bacterial infection on top of the virus. But for the viruses, they usually have to go away on their own, and it's supportive care. Sometimes honey will soothe the throat by coating it. And some herbal teas. There is even, I get a brand, which I don't know if you can see, it's called Throat Coat.
Ooh, yeah.
It's by Traditional Medicinals, and it really is soothing to a viral sore throat. And they either have the original flavor, or this one here is organic with lemon and echinacea. So the herbal kind of things, if the child won't gargle, maybe they'll sip some warm tea. And then another one I like that's not advertised for a sore throat, but I find soothing too, is this from Stash. It's this licorice spice.
Ooh, I'll bet that tastes good.
Yeah, so 2 or 3 cups of sipping on some warm tea throughout the day can help. If the child gets a high fever, rash, or whatnot, that could be a bacterial strep throat, especially if strep has gone through the family or they've had strep throat before. Or if the tonsils get so swollen and big, they're having trouble swallowing, then you worry about more serious complications. That would necessitate a trip to the doctor.
Okay. I just found some cough drops recently, because somebody had recommended Manuka honey to us, and I found some cough drops that are organic Manuka honey and
Nice.
and ginger.
Yeah, ginger is also very soothing. I wasn't aware of those, so that's good for me to know about.
They were
Can
expensive.
you email me that?
Yeah, they were expensive as all get out. I think it was $15 for a small box of them, but I got to tell you, they tasted great.
Oh, awesome. And no sugar or artificial ingredients.
No sugar or artificial ingredients, organic Manuka. So, and I hadn't never heard of Manuka honey before, but the week before somebody had said, "Oh, Manuka honey is particularly wonderful and healing and clean," and I don't know what else. But in any case, I will find that, Dr. Copeland, and I will send you that.
And I'm not a really knowledgeable in terms of herbs, but I know slippery elm and marshmallow, with hot water poured over them, it creates a little mucus film and whatnot. So I hadn't tried it myself, but that's another suggestion if people are really into herbal remedies.
I love the idea of having a little bit of tea, though, because it can be so hard to get a child to gargle. I mean, that's
Right.
like a skill that takes a long time to be able to learn.
Yeah.
And everything else. So if you have them swallow something, then it goes right past the throat and then you're done. So I love the idea of doing a tea. I think that's wonderful. So Dr. Copeland, we had a question. Somebody wrote in and said, OMG, exclamation point. What do you recommend for lice with 3 question marks? They go on to say the package on the stuff I bought says it can cause cancer. Isn't there something else with 3 question marks? So this is a problem that we see in our schools that they're, I'm knocking on some kind of wood. We have not had this issue yet, but for parents who do, to dump a bunch of chemicals on their kid's head, it's not the thing that we all want to do. But what works and what do you recommend?
Yeah, and it's especially concerning while the chemicals do work on the lice. They are pesticides, and we know that children with autism have trouble detoxifying, and that the pesticide exposure seems to be a risk factor for them. So I can understand why this mother is so concerned. So there are natural remedies. It's not, head lice is very common, and the lice like clean hair as much as dirty hair.
Yeah.
So it's just really common to have lice go throughout the school system. Kids pick it up from other kids. So you basically have to smother the lice with something natural to slow them down so you can comb them out. So it's a lot of work.
Okay.
That I have to be honest about. So olive oil works good, or almond oil. So you just really have to oil up the hair. That'll slow any live adult lice out. And then you get a fine nits comb for combing out, a lice comb for combing out. And you just go through the sections of hair. You comb out any of the live adult lice. They're small but visible. And then you also have to get the nits out, which are these white little eggs. They look like tiny white pearls that like to stick to the hair. So basically, you really oil down on the hair. You comb each section. Then you rinse. You shampoo the hair, rinse twice, and do it again. And you basically have to do that olive oil treatment every day for about a week, and combing. The real treatment is combing them out. Okay. And getting all the nits as well. And then, so that would be a natural way of treating it.
And then isn't it important that you also, and I don't know about if everybody else is as itchy as I am right now, just talking about it, I'm like, but don't you then also have to do like all the bedding and the stuffed animals and anything that the child's head has come in contact with?
Be careful with that too. Certainly wash all the combs and brushes, and for girls, the barrettes and hairbands and that sort of thing. And then if there's been and certainly wash their bedding. And if there's been a recurrence, then you might have to do, and they have a lot of stuffed animals. You don't want the nits getting on the toys like stuffed animals. They can live for a couple of weeks. So you can take all the stuffed animals and double bag them in plastic bags for 2 weeks. That will kill any eggs. Okay. So yeah, it's a lot of work.
Wow. But nice to know that if you really don't want to do the chemical thing, that there are other alternatives. I had always heard that you end up having to throw away all the stuffed animals and the kids are hysterical. But I love the idea of double bagging them for 2 weeks so that everything is dead. Wonderful. Thank you for that. We'll keep that in mind. And then we have another question about methyl B lollipops. And maybe we need to start with talking about a little bit about methyl B and why somebody might be interested in having it in a lollipop. And then somebody wants to know, do they work? Does doing a methyl B lollipop work?
Okay, so methyl B refers to methyl B12 or cobalamin. So it's the B12 vitamin, which is very important in our metabolism. And B12 works with another B vitamin, folate. And both the folate and B12 have a lot of action within our metabolic system on a process called methylation. That's adding a little methyl group, which is a carbon with 3 hydrogens, to different chemical compounds. And the control of our body chemistry has a lot to do with methylation. And there is evidence that at least in important subgroups of autism spectrum disorder, maybe not all individuals with autism spectrum disorder, but many subgroups have trouble with their methylation chemistry. So that's the whole interest in vitamin B12 to begin with. And there have been some good research on vitamin B12 shots. Now, it turns out that vitamin B12, when you try to take it by mouth, it's hard to absorb. And historically, they were given as intramuscular shots, and then it was discovered that you could get some absorption with subcutaneous, shallower shots. I can see the desire to get methyl B12 in an oral form, and the idea with the lollipop is because you got it in the methyl form and it's on the tongue. By sucking on the lollipop, perhaps there's better absorption through the tongue, but that, to my knowledge, has not been specifically studied, scientifically studied. So I don't see any evidence that the lollipops work.
Okay.
I don't see any evidence that they don't, but so it depends on the cost of them and if the parents want to give it a try. But I tried to look through and see if there was any research done, and I couldn't find any.
Okay. Because I know for Gem, we did the methyl B shots for a while. And we did the ones where you were just underneath the skin. You were trying to
the subcutaneous.
Yes. And like you said, we had heard for years about people were seeing miraculous things happening with the methyl B12 shots, and I was always just skittish. I wasn't sure that I wanted to try it, but eventually we did, and we saw a big shift for Gem, and it was really good. We haven't been on the shots for a while, but every once in a while he'll say, we should do that again. Because he remembers it as being it helped him to be able to find his words, is what he says. So we had a good time with that. And I know we've had the opportunity to taste, there are a couple of different methyl B12 lollipops. They taste really good. And what I remember about them, they weren't terribly expensive, and they had a lower sugar content than any other kind of lollipop, and they didn't have artificial colors in them. So one of the things that we did for a while was we had them around just as a treat. As a more healthy treat. We weren't using them as a medicinal, but they sure did taste good. I have to say that.
Well, that's good to know, yeah, because I hadn't heard of the lollipops before this question. I knew there was other attempts to use oral methyl B12, but
there's even a spray. Somebody has a spray out, a nasal spray. So yeah. I think there's lots of different, and so I'm glad that somebody asked this question.
Yeah. The whole issue is whether it gets absorbed to work medicinally. I don't have an objection to using the lollipops if they're not unduly expensive or if false claims aren't made about them. But right. it sounds like it's worth doing more research on.
Yeah, and I don't remember them being expensive. And believe me, I'm the type of person that if they were expensive, that's the first thing I would remember. But yeah. I don't remember them being expensive. But in any case, we want to thank you so much for taking the time to be with us and for all the work that you're doing for our kiddos. We want to remind people that if they would like to be seen by your child, and what are the states that they can be seen by your child at this point? Is it just California?
I'm licensed in California, so through CARD at various times I'll be in Northern or Southern California. The other two states that I'm licensed in are Arizona and New York at this time.
Okay, and so if you want to get on Dr. Copeland's schedule, do they call CARD or do they call you?
To call CARD.
Okay.
Yeah, my practice is entirely through CARD.
Okay, so take the 800 number for CARD. You can call that and let them know that you would like to get an appointment to have your child seen by Dr. Copeland in one of those 3 states, whatever is closest to you, and then you can have the opportunity to have one-on-one time with the unicorn.